Diabetes is truly a team sport. No person should have to do it alone. No provider should have to do it alone. No person with diabetes should have to do it alone. And so I think if we really work together, take advantage of everyone on the team, the pharmacist, the dietitian, social worker, psychiatrist, physician, nurse practitioner, everyone on the team, to have a role that we can be successful in overcoming this. But we have to understand it takes effort on everyone's part and everyone working together to make it happen.
When you're talking with the patient and thinking about making a recommendation to a provider, making sure that they know you're going to do it for them helps make that transition smooth. And likewise, when you're going to be making an education point to a patient, letting the provider like, hey, yeah, I'll reach out to the patient and talk about it with them and kind of smooth things over. I find more positive responses when I go about that way, kind of being the effective mediator. I would say when you do reach out, if you're trying to make a recommendation, make sure that you have a solution to the problem you're bringing forward to them, because that's going to help you go a long way. If you're just bringing problems to them without a potential solution, that's not going to be beneficial.
Yeah, it's really important when you have a team to really think of the pharmacist, first of all, to be part of the team. A lot of times I think pharmacists are thought about in maybe just a dispensing arena, but really the pharmacist can help with medication selection. They can help with making sure that the medication is working effectively, that you can afford the regimen that's being prescribed. And then a pharmacist is a really key member in being able to communicate and identify any ongoing gaps.
And I think it's a team effort. I think it takes, right, the provider and the clinical pharmacist, potentially, the nutritionist, the dietitian, right? This is a real collaborative effort to try to help eliminate this. But I think before we get there, we have to be able to identify it, which is super important as well. So being able to let providers know, like, hey, I am a resource for you. Let me take, let me borrow this patient. Let me help you help this patient and give them the education that unfortunately due to your workload, you might want to give, but just don't have the time to do so.
We even had one of our pharmacists at an independent pharmacy do a foot exam, which that's obviously not something you typically think about going to a pharmacist for, but why not? And when that pharmacist was doing the foot exam, they actually identified a foot ulcer that actually had been missed by that person's primary care doctor. So the pharmacist picked up on that, got the patient into a podiatrist so they could get appropriate treatment. So I think there's a lot that pharmacists can do as that access point.
In our practice, our high-risk clinic has been, as I mentioned, has been there since 2011, and I'm the one constant in the clinic. So I've been there since 2011 with the start of the project. And so many of these patients I've been providing care for that long time. And so they know me, and they know me better than some of the providers. And so having that bridge and being able to connect with the patients really helps get that patient to know that somebody cares about them.
Diabetes happens to have a lot of medications that are required to manage it effectively. So the pharmacist is a really, really good provider that can help with diabetes just because of the number of medications that are involved, access to care, affordability to that medication regimen. And so that was, an area that I ended up focusing a lot on, how to make sure people could afford their medications and then have good success with the therapy that they were taking.
Just being confident in the recommendations that you're making, and knowing that we are the drug experts, and we do have the background to make these recommendations, even though we're not the ones prescribing these medications. And a lot of the times, unfortunately, some of these patients do fall through the cracks, and we end up, especially in our position at an independent community pharmacy, kind of having those more personal relationships with patients. I feel like they're sometimes a little bit more vocal about the problems that they are having with their medication regimens or their diabetes medications specifically. So our patients are really relying on us to kind of bridge the gap with their provider.
As a pharmacist working in primary care, one of the primary things that we do is we actually contact the community pharmacist, because we know what information the community pharmacist has that we don't have. And we know that we have information that the community pharmacist doesn't have. So our pharmacy team often does pharmacy to pharmacy phone calls just to figure out whether it's cost of medications, refill histories, all of those things. We do a lot of that. So I think that other pharmacists can really get engaged and get involved in making sure they're advocating for their patients. And if they need some information, don't feel free to reach out to whether it's another pharmacist, whether it's a physician, a nurse, whatever that is, to get whether it's lab work, again, refills, whatever that may be, so you can really optimize that patient's therapy.